Hi students, I'm today going to talk about acute case taking tips. Now number one, you have to remember case taking, acute and chronic का दो different होता है. You cannot mix up both. अगर आपके पास acute case आता है, you can not apply the same strategy how you apply for a chronic case. इन दोनों की strategies अलग हो जाती हैं. So you have to have a strategy, you have to learn a strategy, how you have to solve an acute case and how you have to solve an chronic case. Number two, observe, observe and observe. Without observations, it is very difficult to reach to the minimum in acute cases specifically. I'll tell you a case of mine where a child was having acute fever and he was completely restless in my clinic, right? He was restless, number one. His mother was telling, Beta, sit there. He will not sit there, he will sit on the floor. Then his mother is telling, get up, don't sit on the floor, sit on the examination table. He will not listen. His mother was telling, whatever she was instructing him, he was doing ulta. Then I asked her, like, whether he's following her instructions or not. बोलती, no doctor, since he's having fever, उसको मैं right बोलती तो वो left जाता है. तो कितना important observation है. Contrary was the rubric taken in that case in acute condition. Because Hahnemann ने कहा है कि patient का disposition जो change होता है acute condition में, you have to make it to notice. Otherwise he was a very obedient child. So observe. Observe his energy, observe his mood, observe his facial expressions, observe everything. For example, एक patient आया था, he had acute fever again, बच्चा था, and mother said, "Beg doctor, क्या बोलूँ मैं, बुखार कोई बोलेगा नहीं उसको बुखार है." I said, like, why? He's so active, he's not getting tired, he's just running about, jumping around. What is the remedy? It was just tox. So scan his energy. Now, third important thing is you have to properly learn the art of connecting the dots. Acute में if you will not learn the art how to connect the dots in a case, मतलब कौन से particulars को उठाना है, कौन से generals को उठाना है, कौन से mental symptoms को उठाना है, that's an art. और यही differentiate करता है एक good prescriber और एक bad prescriber में. यही difference करता है एक failed acute case में और एक successful acute case में. So this is the art which you have to learn when you treat an acute case. Most important is you have to have good clinical knowledge. You have to have track about his clinical condition, get his investigations done, be in that process of understanding his investigations, his prognosis. You have to understand the pathophysiology of the disease. For example, patient को cough है, chest में cough congested है. You're treating the cough. If the body starts throwing the cough, if he starts getting watery discharge from the nose and his chest congestion is better, you are on the right track. You don't need to give any remedy, right? So please follow these strategies. Please follow proper strategies which are given in the Organon. Learn them and you will see wonderful results in acute cases.